all are together in your MRCOG Part 2 journey, and we are here to take you through this difficult path. And in this session, particularly, I'm talking about that how we are going to make this journey very smooth for all of us, right? Are you clear about the agenda of the session, right?
Yes, ma'am, inshallah.
Yeah, sure. Who is this side, please?
Dr. Amna.
Dr. Amna. Thank you so much, Dr. Amna, for joining in. So are you planning for July exam?
Yes, ma'am, inshallah. Hope so.
Okay, sure. So all of my dear friends, let me tell you that what we are going to discuss in today's session, right? First of all, I will tell you that what is this exam is all about. We have 4 months, right? It's almost 4 months. So how we have to squeeze the curriculum during this 4 months, what strategies we have to make to cover this all curriculum, because you are not alone in this exam. The people who are appearing in this exam, maybe those people are also with you who are preparing for last 1 year or last 2 years. So, it is very challenging for you to just reach in one go up till their standards. So, it is a very challenging exam. You have to accept it, right? Are you with me, guys? And are you listening to me? Am I audible to everyone?
Yes, ma'am.
Yes, you are.
Okay, sure. All right. So thank you so much. First of all, I can see people are joining in. Okay. A very warm welcome to Rutab. So
Thank you, ma'am.
Okay, so let's start, friends. First of all, let me appreciate you that you people have started and you people have thought about this exam. First of all, you should appreciate yourself for the effort that you are putting in your exam. The efforts that you are doing, you are taking out your time, you are taking out your all the energies and efforts for this exam. You should appreciate yourself, because you know that to see a dream is a capacity that everyone is not capable of having. If you see around yourself, how many people around you are capable of seeing the dreams? This is such a big dream that you are seeing. Why I have pasted this picture over here, so that you can see what is your target, what is your goal, right? This is the thing that you want to achieve, right? So what we have to do to reach this goal, how we have to strategize ourselves, how we have to organize ourselves to reach this goal, because this is such a competitive exam that many people are struggling for this exam for even for months and even sometimes for year as well. So you have to compete with those people, and you are the one who have decided. Whenever you take a decision, whenever you take a decision, it means that half of thing is done. And because everyone cannot take the decision, everyone cannot see the dream. If you have capacity to see the dream, it means you have capacity to achieve your dream as well. And now I am here to hold your hands, to take you through your dream. Let me tell you that this is the thing. Can you see that girl is watching a dream, right? You can see dreams in her eyes, but she's not sitting alone. If you can see, she has wings on her shoulder, right? So this is a girl who is watching the dream. She is capable of watching the dreams. If anyone is capable of watching the dreams, she is capable of achieving the dream as well. Just believe in yourself. First of all, you should have firm belief in yourself that yes, you are special. You are different from other people who are unable to see the dreams. So it means when you are special and you are capable of seeing the dream, it means you have the capacity to achieve the dream as well. And I will helping you in that, because you have figured out the way. First step you have already taken. You have taken out your time. You have taken out your everything aside. You have kept everything aside to bring out the time to see this session. This is the first step that you have taken in direction of your dream. It means that you are thinking about it. You are making the strategy. So the first step is already taken when you are having the capacity to see the dream. Now, what will be the next step? The next step will be this. This is the next step. And we will all together make this possible. Let me tell you that how she has reached over this point, because she has seen the dream. She has made the strategies to fulfill her dreams. She has the capacity. She has acknowledged herself that, yes, I'm different from others. I have the capacity, right? I am making an effort in the right direction. This is the reason that I am here today. So this is the reason. So first of all, appreciate yourself. Don't underestimate yourself. Believe in yourself that, yes, you are different from others. Everyone cannot see the dream. Everyone cannot make an effort. You people have started making effort. Now, how we have to make this effort in the right direction? How we will put all the energies in the right resources, in the right direction? This all we will guide you here, right? So we are all here to guide you that how we will make your dream come true possible, how we will make it possible for you to make your dream come true. Everyone is with me?
Yes, ma'am.
Please, friends, come on, talk to me, because this is not a one-sided lecture, right? I'm here to address all of your issues. Many students are questioning with me on telegrams and in messages like, ma'am, we are having this difficulty in our life, we are having this difficulty, and we are unable to take the course, we are unable to join the study properly. But you know that everything is possible when you are ambitious, when your will is strong. Actually, the will is most important thing. When you're having a strong will, then everything will be possible. Then you will come out of every hurdle when your will is strong, right? You have to, first of all, before making any dream come true, you have to admit this thing, that you have to sacrifice few things. You cannot take everything along with you. You have to make ready to make sacrifices. Only then this dream will come true, and this dream will become possible. What you have to sacrifice, you have to assess in your life what are the things which you can sacrifice and what are the things that you cannot sacrifice. Everyone has reached to this point after sacrifices, right? After sacrifices, then you will be able to achieve this. This is my message of today, is believe in your dreams. When you believe in your dreams, you work in the right direction, you work in the right purpose, your resources are good, and you make your way out of your dreams and you reach to the possibility. So this is the way we will make it possible, and we will help you in this at every step of your preparation. In this session, I will be telling you that how we will help you in this, how we will support you in your journey, how we will make this journey easy for you, because you are the one who have seen the dream. You have taken the first step, right? This is a very right step. Now, what part we are playing in this goal, how we will help you in achieving this goal, how we will make this journey smooth for you. And let me reassure you that we are all here to help you in this with a complete management and with a complete strategy plan. Okay. Now comes the question that how we have to pass the exam in 4 months or 5 months. It's January exam was on 17th, right? So January is already passed. So Feb, March, April, and May, right? June. So it means we have almost 4.5 months, right? Because the last 15 days, you're not going to take any new things in your mind. So in 4.5 months, how we are going to come to the level of those students who are struggling for this exam for many months? How we have to come to that level, because you're going to compete with them. Even if this is your first day, even if you're starting at the very first day, this is you're standing at the 0 level. You have to reach up to that standard. And the passing rate of this exam is very less. So, it is quite difficult to pass this exam. First of all, you have to accept it. Yes, this is a difficult task that I have to achieve, and I will put my 100% effort to pass this exam. Now, how you will pass this exam, friends? First of all, you have to prioritize yourself. You have to prioritize your life, that what is the first priority in your life. In these 4 months, there will be no else priority. Only exam will be your top priority, right? Everything will be coming after the exam. Nothing will happen if you will keep your every other thing in the second priority or the third priority in the last 3 months, in this 3 or 4 months. Because after 3 or 4 months, you are going to be successful. So you will achieve your dream. For achieving your dream is most important, right? And your dream is most precious. So to achieve your dream, you have to prioritize your dream. So what is the top priority? Please come after me. What is the top priority in these 4 months?
Our exam.
Only exam. Your exam is your dream, and your dream is very precious. Keep your dreams at the top of the list in your life. No one else is going to fulfill your dreams. You are the only one who has to do it, right? So keep your dreams at the top priority. When you will fulfill your dreams, you will be a happy person. You will achieve everything. Nothing is precious than your dreams. Your time, your money, anything. Nothing is precious than your dreams. When you achieve your dreams, everything will become secondary in your life. So this will be your priority, eyes on the prize. And to pass the exam is your prize. So your eyes should be on your prize, and nothing should come in between. Anything that comes in between your dream, please kick it out. Kick it out before starting the preparation, and make it a target that this journey from here to here, I will not let anything come in the way between me and my dream. Nothing can come. Your job, your family, your any personal commitments. Nothing will, your enjoyments, your leisure time, nothing is going to come in between these two things. Only two things are left in your life: your priority, your exam, and your dreams. You have to fulfill your dream. So, because as I have already told you, that no one is going to make an effort for you unless you make yourself. You have to make it very clear in your mind first. It is your mindset who will make you successful, right? Many excuses in the life. I have this commitment, I have this commitment, I'm unable to do this 4 months. Ideal time will never come. There is no ideal time in your life. Every time you will have some other sorts of commitments, some other sorts of distractions, some other sort of difficulties in your life. No, ideal time is not going to come. If you will wait for the ideal time, it will never come. You have to make the time ideal. By your prioritization, you will make the time ideal for yourself, right? So you have to sacrifice few things. Ready to make, if you're not ready to make sacrifice, you're not going to achieve anything. So first of all, you should ready to make sacrifices. So exam is your first priority, right? Ambitions. Nothing is achievable without your ambitions. If you're not determined to your goal, if you are not targeted to your goal, if your ambition is not strong enough, then just think about it that yes, it's not like, I'm not like that person. I'm not going to achieve it. If you're not ambitious enough, you have to become ambitious, right? Your ambitions are strong, then everything will fall apart. Everything will stay behind. Only your target and you will be on the mainstream. Only these three things will left behind. Leave everything behind, keep your ambitions arise. And what we are going to do to keep your ambitions high. Every day, I will be discussing in detail that how we are holding the hands of our students and how we will take them through this tough journey to keep them ambitious day and night. We will keep them ambitious because you can see the energy in my voice and you don't know that how much energy I'm holding in myself. So how it is not possible that my students will not be holding that much energy, right? So I will be transmitting them this energy every other day, at every second, and I will not leave their hands. I will not leave them alone, because there is a lot of depressions, distractions, and many things which will distract you from the exam, but you're not going to lose your passion. Keep your passion alive. Next comes the hard work. Nothing is impossible without it. Your ambition will take you to the journey of hard work. As much as ambitious you are, you will become more hardworking. If anyone says you, I prepared this exam in 1 month, in 2 months, in this month, in that month, please don't believe anyone. Believe on my words what I am saying. I will force you to do the hard work. I will make you to do the hard work in my course. No student is allowed to have any leisure time, any luxurious time, any relaxation, any wastage of time in my course. I will keep them committed 24/7. They are not allowed to do anything except hard work, because my target is to pass their exam. The students who have joined me, they will know me with the passage of time that I'm very targeted with my ambitions and my goals. I never leave any of my goal incomplete. Now you are my goal. So mark my word, I will never let you accept passing the exam. There will be no option left for you. Only option for you is to pass the exam. If anyone is with me, he or she is left with no other option except to pass the exam, because failure is a no word for me. I'm never born to be a failure. So if you will fail, then I will fail. It means that my target is to pass your exam, right? I will not let you fail in this exam. This is my promise. And strategies for the exam will be discussed in this session further, that how we are planning for this exam, right? Who else has joined? Very warm welcome, Sahar. So it's a pleasure having you here. Sahar, are you with me? Your mic is mute. Okay, it's okay. Okay. So Dr. Abida, Hina Javed, Dr. Shabnam, Dr. Sidra, Dr. Amna, Dr. Anam, Seher, everyone, listen to me. We have to cover the curriculum, right? And we have to cover the curriculum in a very fast track manner, right? I can take this course to 4 months. I can take to this course into 6 months. I can take this course to whole year as well. But why I'm taking this in a very fast track manner? Because you will not imagine that how fast the time will fly. And everyone will cross the line. People are already standing on the top of the list. If we will make a list of the candidates who are going to pass the next July exam, the front line is already full, right? If you have started right now, you have to take a long jump to reach the top line. You have to take a long jump to reach the first line. So remember, there is no word like this that we will start slowly and then we will gradually increase our temperament and then we will do this, do that. Nothing like this. You have to take a huge start. Otherwise, you will be left behind. Every day, every minute, and every second is counting. The clock is ticking right now, right? And will tick like this, that you will left behind. If you will skip 1 minute, you will skip 1 hour, you will be left behind. There is no turning back. So there is what curriculum we are going to cover. We have to cover green top guidelines, right? Everyone knows that we have to cover green top guidelines. Now, how we have to cover the green top guidelines in our curriculum, in our course, I will be telling you in detail about that. We have to cover the NICE guidelines, right? Now, the 70 to 80% of the exam will be coming from the green top guidelines. If green top guidelines is on your tips, if these are in your tips, just mark my words, you will pass the exam. And you are here not to get the knowledge. You are not here to increase your just clinical knowledge and anything. You are here to clear the exam. Your target is to clear the exam. So just mark my words that green top guideline, there is no other option to leave the green top guideline. 70 to 80% of exam is coming from there. Sometime FSRH and BASH, there are 2 to 3 questions. Sometimes there are 6 questions, but not more than that. So it means it is important and everything will be covered in the course, but not as much as the green top guidelines are. Right now, the NICE guideline, they make a large part of extended match questions, right? I will be telling you that how we have to attempt the extended match questions. Then the book practice, right? Book practice we will be doing in the course. I will be telling you that how we will start the book practice. These are the books, right? Actually, there are lots of books available, but what I will do in my course is that students will do only important books. But all the important books will be covered 4 times during this preparation time. Mark my words, at least 4 times. No one is Einstein over here that who will remember all the book in one go only. You have to cover these books 4 times at least. And how you have to cover these? I am running the session in the evening time for the book practices, and my course students will be receiving. My course students, please be alert and please listen to me carefully what I am telling you right now. Yes, my course students in the morning, they will receive a note, they will receive the PDF of their particular task that they are going to do on that particular day. Every day is written in front of the task. They will receive the task in the morning, right? Or night before. They will receive the task and then they will receive a bundle of questions that they have to do in the morning. They will post the questions. We will post the questions and they will answer those questions as well, right? So in the morning, we will keep them committed by their green top guideline or their NICE guideline. And then we will post the questions and they will do all these books practice in the morning, right? Then what will happen in the evening? For the whole day, they will be doing at their workplace or whatever they will be doing, but they will be covering those green top guidelines. In the evening, then again, a second session of the book practice will start. In this manner, just imagine that how much questions you have to do to cover all these books in 4 times in these months. Just imagine how much questions you have to do. If you will think that 20 questions are enough, 15 questions are enough, 50 questions are enough, you are absolutely wrong. You're doing preparation in the wrong direction. Then no need to bother yourself. You have to complete all these books at least 4 times in these 4 months. Then how you can say that 15 questions are fine, 20 questions are fine? Take the lead. My course students, I will invite them that, yes, please, I want volunteer from you who will be posting the questions day and night, morning and evening. You can divide the time. I will also be posting, my admin will also, course coordinators will be posting the questions, but you have to cover these books 4 times in this time frame, in this 4 months, right? There is no other option for that. There is no other solution except to do all these books. Now, what will happen on the exam day? Any question up till now? Dr. Shabnam, Dr. Sidra, Dr. Seher, Ayat Ahmed, you are very, very brilliant. I can just say that. Dr. JM, I don't know who is she. Dr. JM, Hina Javed, any question, my dear? Anything up till which is not clear right now?
Everything is clear, ma'am.
Okay, thank you so much. Okay, all right. Now let's talk about the exam day. After whole preparation that I will be telling you in detail just after a while, when the exam day will come, even after very good preparation, many students, they are unable to score as much as they are having the knowledge. They are also having the knowledge. They are full of knowledge. Have done practice a lot. They have cleared every concept, but still they are unable to perform as they have expected that they will perform like this. What is the reason behind it actually? They are not knowing the importance of this thing. They are not knowing how much is important to know everything about it, about the time management. You know that in the paper, there are two papers in the MRCOG Part 2 exam. One is paper 1 and other is the paper 2, right? Single best answer questions are the 50 questions. These are the questions that you have already been doing in the Part 1 exam as well. Like there will be a one lead and then 4 or 5 options, and you have to choose one options. And these are pretty simple if you're very good in your knowledge, right? But extended match questions, what about all this extended match questions? They can put you in a quite difficulty, right? And you have to accept it that this is the most difficult part of this exam. Now, who will clear this exam? Exam will, the candidate who will score maximum marks in the extended match questions, he will clear the exam, right? He will be the student, he will be the candidate who will clear this exam, who will score maximum marks in extended match questions, because extended match questions, they almost comprise 60% of the percentage of the marking, and single best answer, they comprise 40% of the marking percentage. So it means only solution to pass the exam is to master yourself in the extended match questions, right? How we will master ourselves in the extended match question? There is one trick that I am giving you right now. I'm giving you this so that you can apply this trick when you are solving the practice books as well, right? What you will do in the extended match question, you will read the lead of the question, right? You will read the question. You will not see the options. There will be many options like A, B, C, D, E, F, like maybe up till O. You are not going, please mute your mic, please, friends. So you are not going to see the options. Your preparation should be at such level that when you will read the question of extended match question, it will come in your mind that yes, I know this is the answer of this question. Now, after that answer will come in your mind, then you will start reading the options. Then you will find the option that is in your mind in between those options that is given in the paper. This is the only way to clear the extended match question, because options will be so close to each other, options will be so similar to each other. There will be only difference of 1 plus or 1 minus. They're very close to each other. So it will become a help for you if you will not practice in this manner. You will not look at the options. You will read the question, you will read the scenario that has been provided, and these are scenario based questions. These will basically check your knowledge, that how you apply the knowledge of your guidelines on the extended match question. This is the basically trick of the examiner, right? This is the straightforward question, like you have already been doing throughout whole of your life. These are the simple questions. Definitely knowledge is also required for single best answers as well, but extended match question, it is very important. Right now, how you will manage the time over there? Only 1 minute for every question, right? Or even less than 1 minute for single best answer. Many students, they complete their single best answer portion in 40 minutes, right? But if you feel that, yes, I want to take a little bit more time, you can complete in 60 minutes or 50 minutes, but never more than 50 or 60 minutes. Otherwise, if you have adequate knowledge and you are sufficiently competent, you can complete your single best answer in 40 minutes, 60 minutes. Now, all the rest of the time will be for extended match question, because many students are complaining that we have just marked tick on the last 5 minutes, in last 10 minutes only. We have completed 20 questions in the last 10 minutes. We have completed 10 questions in the last 3 minutes. It's not possible, because you're not doing in the right way. Definitely, you have to, while going in the examination hall, while going before the exam day, this thing should be in your mind, that I will finish my single best answer paper in 60 minutes or before 60 minutes. This 60 minutes is just a leverage. It's not 60. You can keep it up to 40 or 50. Then definitely it will be for the 60 minutes, right? Am I clear up till now? Okay. So for my course student, let me see who have joined us. And I can see there is chat box. Hina, what are you saying? No, ma'am. Please come again. Okay, it's about voice, right?
Yes, ma'am. That was about voice.
Okay, everything is clear now, Hina?
Yes, ma'am.
Okay, my dear. Hina, my dear, listen to me. What we are going to, how we are going to help you. Because why we are here to provide you help, right? Because with the help, things become easier. And it is the first step of your ambitiousness that you have decided to take in the help, to take the help, right? If you have not decided to take the help, then things will not be, nobody is going to help you. You have to take the help when help is available. What we are going to do in this course, we will be doing the live sessions for all of your modules. My course students have already received the live session schedule, but let me tell you that that is a tentative list only. That is not the final schedule, right? Whatever topic you will feel that you are lacking in that, whatever topic you feel that you are, this is my promise that after my live session, the guideline will be inside of your brain. This is my promise, right? It is impossible that after my session, you are unclear about anything. Let me reassure you, it is impossible, because it never happened that any of my students will be unclear after my explanation, right? I'm a born teacher, by the way. So it is impossible that anyone will be unclear after my discussion. So after the live session, the guideline will be in your brain, and this is my promise, right? Now, what else we are going to do is that these live session schedule, that tentative list has been given to all the course students. Let me tell you that that is not final. We will add many things in that. If anything you feel that it's not pretty clear and you need more detailed explanation about that, we will add further in that. But we have to squeeze the schedule so that you will have left some time for the revision as well, because you have to complete the revision, right? It's not like it's the only one time you will go through the guideline and everything is pretty clear. It's not going to happen. You have to revise the things again and again and again and again. Now, as I have already told you, daily group tasks will be given to you. My students will be kept engaged at every other minute. They will left be no other option except to get engaged, right? And if somebody is smart enough to escape from that engagement, that will be her skills. But otherwise, we will try our best to keep everyone engaged in our group task, right? So group task and the question will be given to you in the morning, and you have to complete this in the 24 hours. I will be very strict about it, because if the daily task will be left behind, then there is no way out to complete that task in the future, right? Whole day busy with the group. You will stay connected with your peers. You will stay connected with your mentors. You will stay connected in your group. You will not stay out of the group for a longer time. Now, there is another, a very, very, a thing that I have already told you that, just a minute. Yeah, there come the TOG articles, right? In the TOG article, let me tell you that no worries about the TOG, because first of all, there is a huge controversies about the TOG articles, that it's a huge curriculum, what we have to do. Don't worry about the TOG, because TOG, from the TOG article, only single best answer questions are coming. No extended match question will be formulated from the TOG articles, right? And what in which aspect the TOG articles are important is that basically there are last 3-year talks, right? So you will be receiving the talk summaries, audio talk summaries will be there. Now, how you have to use those audio talk summaries? These are of only 8 minutes or 10 minutes, right? You will play the audio. You will keep your paper with you wherever you are sitting. You are sitting in your workplace. You are sitting in your offices. You are sitting on your dining tables. You are sitting with your family, wherever you are sitting. You will be listening the talk audio summary. You will holding the copy pencil with you, right? And you will start writing only the important points, only bullet points, 2, 3, 4 points from one talk article, right? Next time you will be listening, you will be again keeping your notes with you, and then you will again see that if I missed something from what Ma'am Asma has told us or not. This is the only way to do the talk articles. And many practice books, they cover all of the questions from the talk articles. Last 3-year talks will be enough. And we will making it's right now it's not there, but we will be making in a few days another folder in the drive that I'm sharing, that will be of old TOG articles, right? Old TOG articles are very, very important. Although they are very old, like from 2014 and from 2013, sometime 2017 as well, but they are very important because many exam questions are coming from them, right? So we have to cover those TOG articles as well. If you will feel some difficulty in that, at the end we can keep a session for that as well, in which I can cover all the old TOG articles like headache, SLE, and chronic kidney disease. Like there are many TOG articles which are very, very important, but these are the old TOG articles, right? So these will also be covered. In the last 3-year TOG, there are many talks, although I have made summaries for everyone, but during the summary, I am telling that this TOG article is important and this is not important, because the lot of additions that Royal College has done in the TOG is basically about gynecology talks and about the talks about the cancer topics, right? So oncology and the gynecology, they have covered a lot in the TOG articles. There are many, many new TOG articles which are covering the oncology and which are covering the gynae topics. So TOG articles are very important for that perspective as well. So we will be doing the TOG articles and FSRH and BASH. Yes, let me tell you that how we are covering the FSRH and BASH. This is our regular course schedule for July 2024 batch. Yes. Listen to me, Hina Javed, and my course students, Dr. Zara, Dr. Abida. What we are going to do in the course is that, listen, like it's 19th, right? On the 19th in the morning, you will receive the recurrent miscarriage guideline, right? You have to cover this recurrent miscarriage guideline. How you have to cover the recurrent miscarriage guideline. You will make the recommendations on your tips, right? Recommendation, there is no option for leaving any of the recommendation. You will read all the recommendations from the recurrent miscarriage guideline, right? And then you will start reading the guideline and you will highlight any important point only in one read. Only in the first read, you have to completely read the guideline. In the second read, you will not require to read the whole guideline. You will hold any highlighter, any pen in your hand, and you will only mark the important points. How you will know that these points are important? On the same day, you will receive a pack of questions, right? That you have to attempt. You will do those question practices, right? Then next day or in the evening as well, in the evening, we will run a second session of the question practices from the practice books, right? So the whole day from morning till evening, you will be engaged and you will be busy while doing green top guidelines, while doing practice questions, while doing all the questions that will be posted in your group. So whole day you will be busy. Next day, you will do the NICE guideline. 21st, on 21st, you will do these 2 TOG articles. You will listen to these TOG article summaries and you will make your notes. And then on the 21st, on the last day of your early pregnancy module curriculum, I will be taking your session. On 21st, there will be your live session, right? Anything is not clear up till now? Anyone want to ask any question, please?
Excuse me, ma'am.
Yeah, sure, Dr. Abida. How are you, my dear?
Ma'am, so Alhamdulillah, ma'am, fine. So, ma'am, we just have to listen the talk article audios. But you are saying we will not study or we will not read the whole talk article of any topic.
Listen, Dr. Abida, everyone has different type of retaining capacities. Please, Dr. Abida, are you done with your question, please, my dear?
Yes, ma'am. Yes, ma'am.
Okay, Dr. Abida. Please mute your mic now. Okay, listen to me.
Yes.
Listen to me what you have to do. This is the list, what you have to cover on that respective day, right? Everyone has the different type of memory, different type of mechanism of retaining the memory, right? You can do either of the things. You can listen to the audio, and along with that, you can open the TOG article in front of you, or you should not need to open the TOG article. You just listen to cover. This means when I have written 21st Jan in front of this, it means you have to cover this. It is up to you how you want to cover these. You can listen to audios as well. You can open the TOG article as well. You can make your notes as well, whatever you want to do. But on 21st Jan, these 2 things will be on your tips, right? Am I clear up till now?
Yes, ma'am.
those audio summaries are more than enough, because as I have told you that this exam is all about prioritization of the resources. If you will give a too much time to these TOG articles, nothing is going to give you any benefit. Do not waste your all the energies on the TOG articles. Do not waste your energies on scientific impact papers. Do not give your energies on the MABRACE. Nothing is going to come from that. Even if the question will come, these will be 1 or 2 or 3 or 4. They are not going to make you fail or pass. Put your energies over here, what I have told you. Put all of your energy. You cannot give everything to these. Everything, it doesn't deserve your equal attention. Only these Green Talk guidelines need your 100% attention, right? Keep them in the place what they deserve. They do not deserve your a lot of time. Actually, you have to cover these things fully, right? Am I clear about it now? But yes, old TOG articles are very, very important, right? The names that I have told you, and I will make a folder for the old TOG articles, and probably I will take a session as well, and I will upload the video on the YouTube. That old TOG articles are very important to cover. These will be covered in the books as well, but still you should not leave any loophole in your preparation. So definitely you have to cover the old TOG articles as well. Then after 21st session, what you have to do? First of all, let me tell you that after the session, you have to go back to the guideline, right? After the session, on 22nd, you will do this, but you will do this when you will be going out in the morning in your workplace. You will complete endometrial hyperplasia guideline before leaving your house. You will complete this. You will not leave it pending in your whole day. That's yes, I will do it in the evening, I will do it in the morning, I will do it in the afternoon. No, no ways. You have to do as earliest as possible, early in the morning, right? You have to complete your task early in the morning, because in the whole day, there are many other things coming on your way. So it will not be possible to complete this. Dr. Abida, am I clear about it, that how we have to cover the TOG articles?
Yes, ma'am. Yes, ma'am.
And Dr. Abida, listen to me, please. All students, please listen to me. Do not worry yourself about the TOG articles. They are not going to make you fail or pass. The things which will make you fail or pass are the Green Talk guidelines and the NICE guidelines, because the extended match questions are the scenario based, right? And in the NICE guideline, there is a pretty clear option of making a lot of scenarios, lot of options, lot of choices. They make a huge twist in the recommendations of the NICE guidelines, right? So I'm making the guidelines slides for the NICE guideline in a particular way, so that you will not have to read the NICE guideline on your own. You have to read from the slides only, because otherwise NICE guidelines are so lengthy, it will take almost 2 to 3 reads to just pick up the important things from that. And that will not be possible for any course, any student. It will take you a lot of time. So to save your time, I have made the slides from the NICE guidelines in such a manner that those slides will be enough. No need to just waste your time, right? This is the antenatal care module, then maternal medicine we will do in 2 chunks, right? But still, even after the 2 chunks, the things will be left behind, we will cover at the end, right? You can mark and you can write everything that will be left so that we can cover at the end. Okay, now coming to the FSRH and the BASH guidelines, right? Many people are asking from me that how we are going to cover the FSRH and the BASH guidelines. Let me tell you that the FSRH and the BASH guidelines will be covered. It's actually a huge curriculum. If you have, anyone has seen the FSRH guideline? Dr. Seher, Dr. Sana, Zahra, Dr. Shabnam, anyone has seen the FSRH guideline, please? How about it?
Yes, ma'am.
It's a huge thing, right? And there's a lot of information. First of all, let me tell you that not many questions will be coming from this part. Although it's a very important part of curriculum, but sometimes students say that only 3 or 4 questions from this part. So, you know, these are not worth it. Like you will do a lot of time and you will do wastage of your time in doing all these, but these are still very important because this is a separate module and you have to attempt this module in MRCOG part 3 as well. There are many stations which are formulated from that. And this is the only time, MRCOG part 2 is the only time when you can make a strong grip on your applied clinical knowledge. In the part 3 exam, there is not enough time. There is only 1.5 months almost, right? There is only 2 months. You will not be having enough time to have a strong grip on the, that is the core curriculum, or you can say the applied clinical knowledge. You will not be able to have enough grip. So this is the time when you have to make a strong grip on FSRH and BASH. and we will make the summaries for the FSRH guidelines. And for the bash, there will be special notes which are very, very concise and which are very, very to the point, which will include all the exam questions, which will include all the important information, and they're very concise. Like it will be just a few pages. You will cover the whole curriculum. For the bash, I can promise few pages, but for FSRH, I cannot promise that it will be few pages only. It will be a bundle, but it will not be a very big bundle. It will be a very small. It will be a very small package in which we will include all the important tables, all the important flow charts, and your FSRH will be done, right? No worries about it. No worries about all these things. These are the talk articles that I was talking about. In oncology, they have added a very, very important. Dr. Abeda, coming to your talk concern again, we can do one more thing, right? If you are concerned that whether the listening the talk summaries will be enough for me or not. What else you can do is that you can see that the talk cervical screening in pregnancy, now talk detecting endometrial cancer, these you can see these are very, very important talk article, right? But there are few talk articles, probably their name on the previous slide. There are few talk articles which are not very important. In every issue, in 1 year, the 4 issues are released, right? In one issue, there are 4 or 5 topics. So all the 5 topics are not important. All the 5 topics are not coming in exam. Usually only 1 or 2 topics in each issue are very, very important. Like cervical cancer in pregnancy, you have seen a lot of recall questions based on this particular topic, that patient with this gestation, having stage 1A, 2A, 2B, CS cervix, now when to deliver, how to deliver. So many questions are coming from this talk article. So if you feel that this talk article is very important, then you can mark it and you can do it from everywhere you feel comfortable with, right? Now, human papilloma virus independent cancer, detecting endometrial cancer, every talk article is not very important. TOG oral anticoagulant is very important, although it's 2020 TOG article. Now, these are the TOG nerve injuries, TOG vascular injuries. These are the old TOG articles. TOG urinary tract injuries during laparoscopy. These are very old TOG articles, but these are very important, right? You cannot leave a single line from this TOG article. You cannot leave a single line, Dr. Abeda, from the nerve injuries TOG. You cannot leave. I will not suggest you to do any summary for this. I will not suggest you to do any summary for this, because any line can come from this as a single best answer question, right? These are not to leave on the summaries only. And now this is, in TOG oophorectomy or the ovarian conservation at the time of hysterectomy for benign diseases. Many controversial points are discussed in this TOG article. This is very important for MRCOG part 3 as well. When you have to counsel the patient that your hysterectomy is being planned, now what is the options for ovarian conservation or the ovarian oophorectomy. This is the TOG article which has given the recommendation. Many gray areas have been covered in this TOG article, right? Am I clear about up till now? Okay, friends, so many questions in this exam, the January exam, have come from the clinical governance, right? So teaching clinical governance, students are not, my students are not going to do themselves. I will be the one who will tell them that how we have to cover it, and they will only do it from my slides, because a lot of content is available, but everything is not important. We have to target the exam only, right? So I will give you the slides which are concerned in from which the exam will come only, from which your questions will be formulated. You are not going to do anything from, a lot of material is available. One reason for the failure is that you are not knowing that where to go, what to choose for the studies. Okay. Any question up till now? Yes, I want to talk a little more about this aspect, right? As I have told you that extended match questions, they are of almost 60% important, and their marks contribution is 60% and single best answer contribution is 40%, right? When you are doing the recall practices in the books, you have seen many students are doing the recall practice. It is very important to do the recall practice. No way and no thoughts about it. It is very important. But let me tell you that 1 or 2 question is not going to make you fail. This is the thing which is going to make you fail. This is the only thing, right? So focus on extended match question from the very first day. From the very first point, you have to focus on the extended match questions. You have to cover the recalls as well. There is a recall folder. Dr. Zara, Dr. Ambreen and Dr. Komal, have you seen the recall folder? right? There is a recall folder. And now what I will suggest to my student is that they will start each and everything simultaneously. You can keep the recalls aside for at least few days, for almost 20 days or 30 days, until things are clear in your mind. The people who are starting from the very beginning, right? They can keep the recalls aside because they're very incomplete and they will make you confused. But otherwise, the people who have already gone through the guidelines at least once or twice, they should take everything with them. They should be doing daily basis. Now, can you come up with that answer that how many questions you are planning in one day? Can anyone tell me, please? What is in your mind that how many questions you have to cover in one day? Any thoughts about it?
100.
100 should be your target. Then you will be able to do 50 to 80, right? 100 should be in your mind. There is no other option. If you are finding out an easy way, there is no easy way, right? Everything should be on one side. You will sacrifice your jobs, you will sacrifice your families, you will sacrifice your sleep, you will sacrifice your leisure time, you will take the break from all the social media apps, right? You will sacrifice your family, you will sacrifice your workplace, you will sacrifice your money and everything, and you will prioritize your exam and you will complete the task of 100 questions. And my course students, before going to sleep, they will post me in the group. In the group, they will post me, or they can post me personally on my number as well, that ma'am, we have completed this much questions. We have done 50 today. We have done 60 today. We have done 100 today. No other option. As I have told you, I will be very strict in that. I will not let you fail. I will hold your hand. I'm not going to fail you. So I will be very strict in that, because I will be in very, I will be very unhappy if somebody will sleep without going above 50, right? You have to reach, take your task to the 100, but there is a flexibility. You can keep your target near 70, 80. Pass MRCOG is also with you. Immediately, along with the books, start Pass MRCOG, start your practice books. Along with that, you can start 2 practice books at a time. You have to cover it from one page to the last, right? From cover to cover, you have to finish your practice book. At least 3 readings you should be doing fully, again and again. If in the Telegram group, again, some book is repeating, join it again do it, because it's not a wastage of the time. It is to improve your memory. Sometime a certain point will come and you will say, yes, we have read this guideline 10 days before and I have already forget this point, and now it is in front of me. So you have to cover these guidelines, and then you have to do the practice book, you have to do the Pass MRCOG, and even strategy questions. Let me tell you, Dr. Abida or Dr. Sana, someone was asking me about the strategy questions, right? Let me tell you that what is the importance of strategy. Actually, Strategy is the e-learning platform from the Royal College of Obstetricians and the Gynecologists. Its theory part is not very important for you. It is important for me because I will formulate many things from that, right? Its theory part is not going to do anything for you, but you have to do the question answer part, right? And the question answer part is quite same. Their changing frequency is very less. These are many old questions. They're not going to change it frequently, but they are actually well formulated questions, right? They are very well formulated. Okay, now may I ask anyone can suggest that which book is the most important and which book we have to start first. I have already put the suggestion in the WhatsApp group that what book should we start. So any suggestion about it, that which book is better? Anyone, please? Okay, let me tell you. Listen.
Andrew Sizer.
Where is Andrew Sizer? Here, yeah. Listen to me, my friends, very carefully, right? Listen to me and mark my words. These books are not only to practice questions, these are to sharpen your memory. These are to memorize the things better. You may have read this guideline with me in the session 10 days before. Then suddenly when you start Brian, there is a question will come when you will say that, yes, ma'am has told something about this, but I'm not unable to recall it. When you will read this question, then your memory will become better, because after 10 days, you are going to read this book, and then you are reinforcing your memory that, yes, what was the answer of this? And you will go back to the guideline. You will go back to the session recording. You will go back and listen to it that, yes, this was the answer. This is the purpose of these books. right? These will tell you that what is the important point in the guideline. The important point in the guideline, I will also tell you. But these will tell you that, yes, I have not read this guideline for last 10 days, for last 20 days. Now suddenly a point came in front of me, right? So these are actually well formulated questions. Let me tell you that these two, Andrea, are very old books, right? EMQs for obstetrics and EMQs for gynecology. But their keys and their questions are very, very formulated in a very organized and very simpler manner. Like, you will start loving these two books. And the Conje, let me tell you, this is the book from where your exam will be coming. Mark my words. Your exam will be having many questions straight from this book. Many questions will be straight out of this book. If you will leave this book and you will go for exam, you are missing out many questions, my dear friends. And let me tell you that you have to start Conje when you are having a strong grip on your curriculum. Because the students who are complaining that keys are wrong, those students unfortunately have not covered the theory part well. This is the reason that they are saying that keys are wrong. Probably some keys may be wrong, but not all the keys are wrong, right? Mostly keys are right. Almost, if you can say, what I can assess is that more than 95% keys are right. Maybe some keys may be wrong, but mostly keys are right. The only thing is that you are lacking in your theory knowledge. This is the reason you are saying and you are picking up, because options are very close. So they are, you will perceive that keys are wrong. Keys are not wrong, my friends. Keys are right. So you cannot go to the exam without doing Conje. And you have, this book should be on your tips, right? This is the book from your exam questions will be coming. When I appeared in exam, almost 4 to 5 questions from this book, or probably maybe more than that. But I was not knowing exactly that how much is important this book is. So I was not knowing at that time. This is the reason I was not, at that time, I was not pretty sure about it. But now I am telling you that this is the most important book. But the most important thing is that you should start this book when you have a grip on your knowledge, right? Because it is truly, truly assessing your knowledge. This is a very well formulated book, Rekha, and the questions are very good. Now, this is also a very important book. Embryo-sizer questions are coming in the exam. Simple to start is from the Amanda Johns or the Bryan. These are the very simple books, and you can take a good start. At the end, let me tell you, my friend, at what point you have to reach. If you want to assess yourself that whether now I am a suitable candidate to pass the exam or not, what should be the result at the end of 4 months journey, you should reach at the point that this Amanda John will be finished in 1 hour, right? It can be finished in 1 or 2 hours. These will be finished in 1 or 2 hours, right? And you have to practice these books so much that at the end of the day, you will be holding this book from the front page, from the first page to the last page. You will be finishing this book in 2 hours. And you will post in my group, ma'am, I have done this. Ma'am, I have done this. I have done this. I have done this. This is not going to finish in 1 hour, right? It will take your time. It will take your mind. It will take your a lot of energy. This is formulated in this. I'm a big fan of this book, right? Many students are complaining about it, but let me tell you, when you will reach at the end of the story, then you will say the same words, what I am telling you, that this is the best book. This is coming in your exam. This is the key of your exam, right? So never leave this. Don't go in exam without doing this book. These all books should be in your tips. 1 hour, 2 hour, 1 hour, 2 hour. You should finish it like this. In minutes, it should be end. Because you are facing a very, very competitive exam. Don't underestimate yourself that I am reading in a leisure time. I am just folding the pages and the book will be done after 3 days, after 5 days. No, not like this. And listen to me, mark my words, no one is doing to do green top guidelines without putting the timer. You have to put the backward timer or whatever it is called, but you have to start. Yes, I have started this guideline. Now I will finish this guideline in 60 minutes. I will finish this guideline in 1.5 hours. And in 1.5 hours, you will not touch your phone. You will not open the door of your phone. Open the door of your room. You will not allow any distraction in your life. You will finish that guideline in 1.5 hours or 2 hours or 60 minutes, whatever time it will take, because in the first reading, it will take time. In the second reading, it will take less time. 4 readings of the green top guidelines are must. No one can go to the exam without doing curriculum, revising whole curriculum 4 times, because people are going in the exam after 10 revisions. Can you imagine? People are going in the exam after 10 revisions. You have to compete with those people. Then how you are taking any light edge? You cannot take it. I will not make things easier for you. I will tell you that you have to do things on yourself. You have to put that much effort. Then you're ready for the success. Be ready for the success. I'm not going to scare you that you have to study a lot. But if you are determined enough, if you are ambitious enough, then this is not a difficult task for you. Eyes on the prize. Your eyes should be on the prize. Then things will be looking very simpler for you. Things will be very easier for you. Then you will feeling happy for you. And just post me your success. Just post me your achievement. Ma'am, I have done this book in 2 hours. Ma'am, I have done this guideline in 30 minutes. Everything is on my tips. And just listen, my course students, another task for you. Okay, another task for you is that whenever you will do the guidelines, Sana Zahra, Dr. Abida, Dr. Komal, please listen to me, Dr. Ambreen. Whenever you will finish the guideline, you will open the group, you will open the audio, and you will just speak the important points and you will post in the group, right? That will be your quick revision. If you are not doing at that time in the morning, next stage when you will open, you have to revise the previous guideline. Let me reach the curriculum. Just a minute. Dr. Ambreen, are you listening to me? Are you with me?
Yes, I'm here with you.
Okay, listen, on 17th January, you have done this guideline, right? On 18th, you are going to do these two guidelines. Now, where this has left, you are not going to leave it behind, right? Next day, you will take out your time. You will take out 30 minutes, you will take out 40 minutes, or you will take out 60 minutes, and you will revise these guidelines, right? You will make a planner for the revision so that at the end, from the 17th January, when we will reach at the end of the course, your 2 revisions should be completed. It's not the schedule for 1 revision. It is a schedule for the 2 revisions. I will be more than happy if my student will post anything on my personal Telegram, on my personal WhatsApp, if he or she will post any recording, if he or she will post anything, yes, ma'am, I have completed this class, I will be the happiest person. This is my achievement. If you will do 2 revisions with me, this will be my achievement. If you will do 1 revision with me, this is not my achievement. I want my students to do complete 2 revisions with me because I am planning this course and this curriculum in such a manner that after finishing this, you still will be left with a time, you still will be left with a adequate time to make further 3 revisions as well. You should target 5 revisions, at least 5 revisions to reach in the peak of the list. There is already list formulated. People who are struggling for 6 months, for 5 months, for 1 year, they have already standing in the queue. You have to reach on the front line of the queue. So do you understand that how much effort you have to put? This is the effort that you have to put. And what I will be the happiest person when you will complete the guideline and you will post me a message, ma'am, I have done this. I will be the happiest person. Then why to keep me away from this happiness? Please finish these guidelines immediately and post me the messages, and the group should be full of your messages. Please keep all of your activities aside. Please keep just for the, as I have already told you in the beginning of the session, that your dream is more precious. Your dream is precious than your job. Your dream is precious than your everything that comes in between. And do not let anything come in between your dream and you. Just eyes on the prize. Just target your dream and reach there, right? Just have you seen the lion who is just attacking on the prey, right? Just in that manner. You have to be that lion and you have to attack because there is no other way. If you will sit in a comfortable manner, come out of your comfort zone. There is no comfort zone for this exam. When you will come out of your MRCOG part 2, then you will see that comfort zone is worth enough, right? Then you can go to your comfort zone because part 3 is not as much huge curriculum. Curriculum is not that much huge. I will be taking you in the part 3 journey as well with me. You people will be with me in the part 3 journey as well. So I want to discuss one more thing. Let me, many students are asking me question that, ma'am, how many hours we need to study in a day? Can I ask that what you people think that how many hours will be enough in a day? A very warm welcome, Dr. Vajiha. You are with me. I have just seen the participants. Hello, Vajiha, my dear.
Hello, ma'am. How are you?
I'm fine. You are my baby, right?
Yeah, we met
Okay.
4 years
So,
ago.
Vajiha, can you come up
You
with
were
the
my
thoughts?
ma'am.
Yeah, it's so pleasure having you here.
Same here, ma'am.
Thank you so much, Vajiha. Okay, can anyone tell me that how many hours you can make out in a day to study? And what are your plans that if you're going for this journey, MRCOG Part 2, how many hours you want to make it out?
At least I think we should study 6 to 8 hours. I don't know, but that's the plan I have, inshallah.
6 to 8 hours. Wonderful. Vajiha, it's a very, very good thought. These are very good thoughts about it. But let me tell you about one thing. 6 to 8 hours are if you're holding something like your phone or your green top guideline, right? But this exam and its curriculum should be in your mind 24/7, right? There should not be a second in your day or night when this exam is out of your mind. This exam will be in your head, then you will pass the exam, right? This is not MRCOG Part 1. This is not MRCOG Part 3. This is Part 2, the most difficult step. 80% of the student will stuck in this exam. Let me tell you, this is a fact, right? 80% of the students will stuck in this exam. And after getting disheartened, many will leave this exam as well. But I will not let it happen, right? 24/7, this exam should be in your mind.
Yes.
While waking up, while sleeping, while eating, while going anywhere. This exam should be in your mind. In next 4 months, you are not going to do anything except this exam. 6 to 8 hours are, in my thought, these are very less. I'm sorry to say, but I think this exam demand a lot of time. So all the time, listen to me. I will organize these things for you. You wake up in the morning, right? You have done your guideline. You will take 1 or 2 hours. You will wake up 1 or 2 hours before the time that you're already used to wake up, right? You will do your guideline. You will do all the preparations and you will go to the workplace if you're doing any job. In the job, what are your priority? Take out the time for your study, right? You will again take out your things and you will start study. You are coming back. You are sitting in your cars and you're probably not driving, then you can definitely at that time you can listen. If you're driving, you can listen to your audios. If you're not driving, you can again open your notes and you can start study. You will not waste your time that when I will reach back to home, I will take rest, I will take a cup of coffee, I will take a cup of tea, then I will have gossips with my family and then I will start study. No, not at all. No ways. All the time, walking, running, eating, drinking, whatever you are doing, you will be doing. And what you can do in the workplace, MCQs, these are the single best answer questions or the practice book. These are the pretty smart things to do in the workplace, right? Because in the workplace, you cannot take out a long period of time. Like you cannot take out 1 hour or 2 hours, but definitely you can take out 3 minutes. You can definitely take out 5 minutes. In your operation theaters, you can take out, right? So practice books will be with you. You are waiting for anything, you will start your practice book, right? Finish it, just finish it. Just mark your word that today I have to finish this book. Today I have to finish this book. So in the workplace, while you are traveling, at any time, keep the practice book with you, right? Definitely guidelines need a lot of time and they will need your concentration as well. But when you are here and there, then you can do your practice question as well. So this is about the how much time we have to take out. Now I think it's clear that how much time you have to take out. Then listen, if anything you feel that yes, I have read it, but I don't know why I'm not recalling it again when I'm doing the practice book. Pick up the sticky notes, right? The sticky notes available everywhere. Make the notes on the sticky notes and stick them on your walls, on your doors, on your side tables, while getting out of the bed, while going opening your cupboards, while going out of your room, while coming inside your room. Every time your eyes will be on the sticky notes, right? Do not let anything come in between you and your target, right? So your target is to pass this exam. Now coming, many of you probably have filled the expression of interest forms, or some of you have left. Okay. So friend, this is about the procedure that how we have to, okay, anything up till not clear, please, you can ask me. Any questions up till now?
Ma'am, about the recall folder, is it the one on Telegram, the other group?
Who is there? May I know, please?
Rutab, ma'am, Rutab.
Rutab, my dear, let me tell you. My dear, Recall folders are there. Yes, there are a lot of recalls available. Even new recall folders are also there. January and July 2023 and January 2023. Recalls are also there. And Rutab, have you started the recalls, my dear?
No, ma'am, that's why I'm asking.
If you have done at least one read of your guidelines or your curriculum, then that will be a better time to start the recalls. But if you feel that, yes, I should do the recalls simultaneously, then you can do. If you can take out time for the recalls as well, you can start the recalls, because at the end, people will get panic and people will just searching here and there. What is the key for this? What is the key for this? So this is the best time to make the keys, because you're composed. You are knowing that, yes, we have enough time. The composure is better at this time. So I'm already suggesting the same thing that I have suggested from the very first day, that start everything simultaneously. Start theory part, start recalls, start practice book, start past MRCOG, start everything together, right? Because time is very less. You cannot do like this, that 3 months I will do this and after 3 months I will start like this. No, people are searching for the keys at the very last day. So I think it will not happen if you will start it from the very first day. So my dear Rutab, if you will go in the file section, there are many recalls. And if you are unable to find any recall file, you can personally message me. I will provide you, right?
Okay, thank you, ma'am.
Yeah, sure. Okay, so friends who have not yet filled the expression of interest form, it should be filled, right? These are the, I have taken these screenshots from the Royal College of Obstetricians and the Gynecologists page, right? And this is the exam booking page. You can go to the website and then there is exam booking option. They will be coming. Just to memorize you again and just to remind you again, I have added these slides that expression of interest form will close on the 29th March, Friday. So you have to fill the expression of interest form up till 29th March. Because the people who will fill the expression of interest form, they will receive the email on the booking day. When the booking window will open, when the application window will open on the 23rd April, at that time, they will receive the email. So it is very important to fill the expression of interest form. You must fill it. Otherwise, they will not send you email. You have to fill the expression of interest form. Then you will receive the email on 23rd April when the booking window will open. Anyone has already, may I know that anyone has already filled that form or has gone through the booking process? Yes. What is the exact procedure for booking the exam is that for those who have filled the expression of interest form, they will receive an email, right? They will receive an email. Any questions, please, friends? Okay, when the application window will open, then they will receive an email which will take them to the portal, right? They will take you to the RCOG exam candidate portal, and then there will be the whole procedure that how you have to book the exam. You will log in with your email ID, with which you have already logged in with your account in the Royal College of Obstetricians and the Gynecologists, and you will use your password. You will already copy paste all the information over there, so that, because it's sometimes a matter of seconds or minutes. So it is first come, first served basis. The seats will be available. So this link, the link that will be shared to you with the email, that will take you to the available seats in your Pearson Center, and then you will book your exam. It is a matter of seconds or minutes. You will be ready with your 2 credit cards, and they will take your charge fee. They will charge your fee, and you will book your exam, because I don't want anything happen to you that you are make a plan for your studies and you will be unable at the end of the story, you will unable to book your exam. I don't want this thing to happen at any of my students, right? So you make sure that you will be knowing all the procedure how you have to book the exam. So first step is fill the expression of interest form. Second step is you should be knowing the date, that when the date is there, right? When there will be a date and when they will be booking window will open, you will open the link at that day, and the time will be mentioned. When the email will come, the date and time will be mentioned on that email, right? So you will click the link on that particular time. You will be ready almost half an hour before that time with your laptops, with your credit cards, and then at the required time you will click the button and you will book your exam, right? Now, friends, if you want to start your journey with us, this is the contact number and this is the email address. I'm all here on my Telegram group as well, on my YouTube channels, my Facebook group, everywhere I'm here, anytime, any help available. I'm more than happy to help you. If anyone want to ask any question, please, I'm open to the questions. If anything disturbing in your mind, that how we will cope with this, how we will manage the time, how we will manage the guidelines, how we will manage the curriculum, any question in your mind, friends, because this is the session all about how we will take this journey. And from the next session, we are starting the early pregnancy module, right? So can you please ask if there is any question, please? Can I see the chat box? There is chat 19. Okay. Abida, whole day is not enough. Sin included
Yes,
in
ma'am.
oncology.
I think for the beginners, it is not enough to cover everything in just 24 hours.
Abida, let me tell you. Listen, the people who have passed the exam, they have not covered the whole curriculum, right? This is a fact. So what you have to do is that you have to target. You have to target the important things. The people who have passed this exam, they were not knowing each and everything, right? They have targeted the right things only. So you have to target the right thing. You can leave the top articles, you can leave any MABRACE, you can leave any clinical governance aspect, but you cannot leave the green top guideline, right? You cannot leave anything behind like this, which is most important. Medicine included in oncology. Actually, Sidra Salim, my dear, what I have done is that I have planned in such a manner that it will be included in the pre-malignant lesions, right? I will be taking session, but it will depend upon the length of the session. Like if I will take a lot of time in the guidelines so that everybody can understand it quite well, then I can divide the session as well. But what I have prepared is that in pre-malignant lesions, right?
Okay, ma'am.
So, Dr. Abida, you have to take out the time. You will be in this exam 24/7. There is no other option. I'm sorry, I cannot guide anything wrong to you guys that read 5 hours and you will pass, read 3 hours and you will pass. It's not going to happen. My dear all, you have to take out time. My sweetheart, this is the reason that I'm here to tell you the truth, that yes, you have to take out the time, right? Okay, so any further questions, please? You're trying hard. That's so nice of you. I am with you and I will, yeah, we will take you with us. Don't worry about it. Now I have taken the burden. Can you imagine that how much stressed I am? I am stressed for your success. And when I take a target, I can never leave it unfulfilled. Just mark my words. This is my basic instinct. I can't change it. I'm born like this. I cannot leave my target unfulfilled. So your success is my responsibility. Okay, all right. So no more questions. Thank you so much. Yeah, Dr. Amina Ehsan, recording will be available. Yeah. Okay, all right. So thank you so much, my friends. Thank you so much. And we will see you in the next session with early pregnancy module. And your task will be given to you on your groups. And you have to complete your daily task, because in the early pregnancy module, I will be asking questions as well. And we will have lots of good discussion. There will be many good things are coming for you in the next session. And I will try to make things pretty simpler for you, right? So the guideline will no more be a trouble for you after the session, right? So thank you so much. Any other question up till now? The contact number and the email address is visible in front of you on the screen. So please, if anyone want to join us in this difficult journey, we are here waiting for you open hands. So you can start your journey with us, right? Thank you so much, friends. Thank you for your time. Bye bye. Have a great day.